Alright, so today we are seeing our 36-year-old patient who is struggling with back pain. She thinks this back pain is caused from lifting her daughter out of her crib. It's been bothering her for about 2 months. She went and got an x-ray and that ruled out any fractures, so we think it's just a pulled muscle or muscle strain. She reports her back pain at a 6 out of 10. So today in the clinic we are using TENS, which the main purpose of TENS is to help with pain, and it also can decrease muscle spasms. So those are the probably two primary indications. TENS involves applying two electrical stimulation pads over the affected area, and this stimulates the nerve fibers to produce a physiological effect for pain control. With TENS, the main goal is to stimulate those A beta fibers because this is just a sensory stimulation. Since we are targeting the A beta fibers, this means that we are using the gate control theory. Some precautions that we want to ask our patient before we get started, just to make sure she doesn't have any other undiagnosed pain, any cardiac disease, make sure she's able to communicate, she doesn't have any compromised skin or adhesive allergies, and then some overall contraindications would be active cancer, impaired mentation, patients with a pacemaker, or a problem with like seizure disorders or epilepsy. Hi Audrey, how are you doing?
Good, how are you?
Good. I hear you're in here for some back pain.
Yeah, my back hurts pretty bad.
So we think it's just like a pulled muscle or muscle strain. I heard an x-ray ruled out any kind of fractures or anything like that.
Yeah.
You said it's mostly from trying to pick up your baby out of its crib or just like leaning over and lifting her.
Yeah, I've been lifting her a lot lately because she loves to be held, so it's been a lot.
I'm sure.
Mm-hmm.
And then I also noted that your pain normally sits at a 6 out of 10, which is pretty high.
Yeah, sometimes even a little worse.
Okay. So today we're going to try something called TENS. Have you ever heard of it before?
No.
So basically TENS, I'm going to put two electrical pads on your affected area on your back. And basically this is going to send like electrical stimulation to the affected area. You're going to feel this little tingling response. We don't want any muscle contractions. It's just very sensational. It's just used to help with your pain. If you have any pain at any time, you can turn it off or decrease the settings. But overall, does that sound okay with you?
Yeah, that sounds great.
Alrighty. So first, I'm gonna get your little TENS unit set up. So it looks like this, and we're gonna use this one today just because if this actually helps with your pain, then we can talk with insurance and hopefully they could send one of these home with you.
Oh, that'd be nice.
And you can use that at home.
Okay.
Alright, so today when we use this on Audrey, we're using biphasic pulse current TENS. So for this, with the width, we normally want it at 80, which it's already set to. And then the width we want to from 50 to 100. So we're going to set that to probably 80 just because the width, it's on her back, so it's kind of a bigger area. So 50 might be too low and 100 might be too high. So we're going to try and set it right in the middle. So set that. And then the rate, we normally want the rate from 80 to 100, and I just set it at 80 for now, which it's already set up at. And then we also have it at normal right here, just because with this, we want to use conventional TENS, and then this would be considered normal. So we set this up. We're on channel 1, which looks good. Alrighty, so now I'm going to bring this over here. And do you mind if I pull your t-shirt up and put these pads on you?
No, that's okay.
And then before we put these on you, I just want to confirm that you don't have any like adhesive allergies or impaired sensation or anything like that?
Nope, none.
Any pregnancy?
Nope.
Okay. So your back pain seems to be right around here?
Yeah, it's like right above my shorts level.
Right above your shorts level, and then just on this one side, right?
Yep.
Okay. Alright, that feel okay?
Yeah.
Sorry if they're a little cold.
That's okay.
And we're gonna get this started. When I go, I'm just gonna do this super slowly. And as soon as you feel that tingling, then we'll leave it there, okay?
Okay.
So let me know.
Now I feel a little tingle.
Feel a little bit? Alrighty. So we're gonna leave this here. Does that feel comfortable?
Yeah, it feels good.
Just a nice little sensation. Alright, now that we got Miss Audrey all set up on the TENS unit, I'm going to set a timer for 20 minutes. It normally goes from 20 to 30 minutes, but since this is her first time using it, we just want to make sure that she feels comfortable and it doesn't go for too long. So I'll set this for 20 minutes and also leave this timer here. Audrey, if you have any pain or if you don't start feeling anything, we lose sensation and we need to increase it, or if it becomes painful, you're just going to ring this bell for me. I'm going to put it right behind your hand right here.
Okay.
Ring this and I'll come over, just because probably if I'm setting it for 20 to 30 minutes, I'm not just going to sit here and watch her do it. I'm probably going to go work with other patients. Alrighty, so 20 and 30 minutes would go, or 20 minutes would go by. I'm going to turn this off. How did that feel?
Really good.
Good?
Mm-hmm.
What's your pain level at right now?
It was a 6. It's probably like a 2 right now.
Good. That's what we want. This is all used, to decrease your pain. I'm taking these off and I'm noticing that her skin is intact and it doesn't look like she had any reaction to the adhesion. I'm gonna put your shirt down.
Perfect.
And then hopefully we can talk with insurance and one of these sent home with you.
Awesome.
Sounds good?
Yeah.
Do you have any other questions?
I don't think so.
Awesome.